Well, I'd like to welcome to Straight Talk today a select number of directors with the IEHA, the International Executive Housekeepers Association. We're getting together today to talk about this pandemic and the solutions that they've implemented for the challenges that have come up. So I'm going to mention who's here with us today, and then we'll get into our questions and learn from their expertise at their facilities. We have Greg Gardner. Greg is the Director of Environmental Services for Duke University Medical Center. Welcome, Greg.
Thank you very much.
We have Steve Johnson. Steve is a Director of Environmental Health and Safety for NVE Corporation. Steve, welcome to Straight Talk.
Thank you, Jeff.
And then we have Mary Vogenthaler, who doesn't have a webcam today, so she's just going to talk to us, and that's cool. So Mary, welcome to Straight Talk.
Thank you very much.
Yeah, Director of Housekeeping for DeKalb Area, Housekeeping and Laundry Services for DeKalb Area Retirement Center. And we have, of course, Mike Patterson, who's a Executive Director of IEHA, a division of ISSA. So those are the introductions. So you guys ready?
Thank you, Jeff. Yes.
All right. So we just have a few questions. The people that watch this are in facilities and they face some of the same challenges that you folks face. And as IEHA, you are leaders in the industry. So we look forward to what you have to say. Steve, let's start with you with this question. So thinking about when the pandemic started and the challenges that you faced with your work, can you tell us about one of those challenges you faced and how you overcame it?
Sure. I think one of the challenges that I had is that I'm no longer in the healthcare industry. I'm now on the business occupancy side of things. So it's basically tag I missed. So I got to figure out what to do, when to do it, and how to do it. So therefore, I needed particular guidance. I've been in healthcare basically all my life as a Navy healthcare provider for 20 years. And then I knew that when I got out of the Navy, I wanted to continue into the service industry. So I looked at environmental health and safety. That kind of kept me intertwined between, healthcare and those who are in the non-healthcare industry. So I needed to make sure that our employees were educated. But in order to do that, when it comes to the pandemic, is I needed resources. Who do I go to? Well, going back to my healthcare industry, we know that the hospitals, at least in the USA, they depend on the CDC website for guidance. And of course, along with the CDC, you also have your local health departments, your governors, your mayors, and you look at their sites for guidance. But I find myself in a little bit of a unique situation is that since I'm no longer in the healthcare industry, NVE, they provide services, facility operations and maintenance services to a lot of government entities, whether it be hospital, with the IRS, and other contracts that we deal with. And so they also have leaders on their side that provide guidance from the federal and state side. So I had to be able to work with these entities to bring forth a policy for NVE, because what we did on the corporate level, our employees worked in these Department of State and federal facilities, and we need to make sure that we didn't cross one another's boundaries and that we're all communicating the same message. So the first thing we NVE did, we looked at all the guidance that was in place from the CDC, from the governor and local communities. And then we reached out to the federal facilities, Department of State facilities, to their safety personnel. And we come together with one unique message that applied to everyone. And so in so doing, that helped us get the message out to everybody collectively, and they were all using the same platform, and we were good to go from there.
So a lot about communication.
Communication, IT services.
Yeah.
We really got a chance to test our IT foundation. From an NVE, from a corporate standpoint, we were pretty good to go. But reaching out when you're dealing with the government and their IT infrastructure, because of the security clearances and so forth, we need to make sure that we were all using the same platform, like Zoom. Government uses Zoom, we use Zoom, so it worked ideally in this situation.
Fantastic. Now, you mentioned working with the IRS. Do you know someone there I could talk to? I need to fix something.
You may not want to talk to them.
You're
at all.
right. Very cool.
So that's just one of our customers. We subcontract with other Department of State organizations as well. And but we all seem to be on the same page. And then that's just, first, it comes to safety of the personnel. Mm-hmm. If our personnel are not safe, then the rest of it's going to kind of go downhill from there.
Well, thanks for that. How about you, Greg?
I think one of the toughest things that we faced here with the pandemic has been, well, I guess it's kind of a two-parter. One, definitely a communication piece, being that everybody's kind of scrambling to get the supplies, resources they need, and trying to take care of their patients. We've been fortunate that being that we have such great relationships with the state and local government, with other universities, and we've had that, what's what I'm looking for? Our network ability
Mm-hmm.
to network with other universities and organizations. We've been able to definitely know what we want to do, follow CDC guidelines, share information with some of our sister hospitals and the other states that have been successful in New York and other places like that. And part of that networking opportunity is because we have so many research facilities here. We've been a research leader for so long. They tapped into that network and have used some of our research to provide sanitizer and things like that to their facilities. The other tough thing that has been an issue is getting resources.
Jeff, can I tag onto that a little bit as well?
If Greg will let you.
Yeah, go ahead. Okay, I'll keep going.
Go ahead.
Basically, with resources being limited, definitely the public at large sometimes are ignorant to what the pandemic, what the problems that the pandemic actually pose, as far as the health risks and the need to be out and going out and masked or unmasked. And because of that, getting additional resources to come in and help us is a challenge, because some people don't want to do that. Some people are afraid to go to a healthcare facility, and with the fear of contracting or being exposed, what have you. So that kind of limited us as well. And then we had some of our workforce went to other places to help, as traveling nurses and what have you, to areas that were hit harder than we were. But the thing that has worked for us, even though it was a tough thing, was, again, going back to the communication piece, was that because we had those relationships with some of the other hospitals, we were sharing staff and ideas and things like that. When the time came to where we were getting close to our hitting our spike in cases, we were able to get some of those resources back. We got staff from other states to come in and help us, and really help us learn from what they did at the other hospitals, and then plan for the future, any future spikes, any future supply outages, any future other resources that are needed, sanitizer, workarounds for delays in supplies and what have you. So the communication piece has been one of the toughest challenges, but also it's actually made us stronger going forward. And it's really helped us in that respect, if you could follow any of that. Sorry.
Yeah. So somewhat a similar theme. You have challenges, but communication is a way to overcome it. Networking.
Definitely. Yeah.
All right, let's move to Mary and ask her thoughts on what challenge and solution did you want to share with us today?
Well, actually, just a little bit of background on our facility. We're located about 70 miles west of Chicago, who had quite a number as far as COVID goes. some of the challenges that we faced is really, just kind of keeping an eye on things and watching it creep a little closer to us. We're a single site, not-for-profit retirement community. And I think our benefit is that we are totally private. So we can distance ourselves from everyone else who are seeing some of those issues. I'm very pleased to say that as of today, we have 0 cases. And we have had 0 cases, and we would like to keep it that way. Some of the major challenges that we've actually faced is the PPE and supply chain shortages that we're seeing. We've followed along with the CDC guidelines and IDPH guidelines. We have a pretty good, pretty complete COVID plan in place. So really, it all kind of came down to educating our staff. And I think we've done a really good job of doing that and probably continue to do that going forward. We do a lot of screening of our staff a couple of times a day, and they understand the seriousness of what's going on out in the community. And they try very, very hard not to bring it into this particular community. So
did I hear you right that you have 0 COVID cases in your facility?
0 COVID cases.
And in the news, it seems like nursing homes and retirement centers are suffering.
Yes. We made the decision early on to close our doors right away to outside visitors. We have approximately 250 residents in all areas, in independent living, sheltered care, and then our nursing home section. Yeah. So we're a full circle CCRC.
Well, I'm impressed. Mike, I imagine you're proud of that as director of IEHA, and one of your facilities under that umbrella has done so well.
Yeah, there was a lot of education involved in that regarding the staff. Most of it was honestly keeping our staff calm and cool and just kind of going through the different areas, all areas, not only housekeeping, but nursing and food service, and just educating everyone on the basics, just getting back to the basics. Mm-hmm. And it's a lot of anxiety out there.
Yes. I read in an article recently that I think it said like nearly 40% of all deaths from COVID were related to nursing homes. So
that sounds about right.
Yeah.
Mm-hmm.
But Mary, it's very easy. It's very easy. Mary's an exceptional case, and we have some others in IEHA that are very similar that run nursing homes, but they understand. They understand their role as directors. Their nursing department and administrators and things get together, as Mary said early on, and make quick decisions, knowing that a failed decision could lead to someone losing their life over something that they could have possibly prevented. So kudos to Mary and the DeKalb Retirement Center there in DeKalb, Illinois.
Yeah. You might have new applicants knocking on your door.
That's awesome. Where can I go?
Yeah, that is really awesome. So what a fantastic.
That's right.
Fantastic story to share. All right. Anything else before we move on from Steve or Greg or? All right. So here's my.
Let me say this, Jeff. IEHA has taken a lot of time. And during this COVID scenario, as you say, communication has been important because I know that I personally have communicated with a lot of directors throughout the pandemic in hopes of trying to assist them. Obviously, we have some that are not as senior as maybe Greg or Mary or even Steve. So they were looking for help or guidance. So I was glad that we were able to provide them in real time with things that they could do in order to make sure that their department was running correctly and that they were doing what they were supposed to do.
Yeah, I'm sure you all coming together and sharing ideas. What I'm hearing here is a lot of concentration on better communication and networking and working together. So my next question is probably going to be about that. So here it is. What have you done during this pandemic that you plan to carry on afterwards? And let's start with you, Greg.
Okay, it's funny you should say that. I think some of the relationships that we were able to establish during the pandemic with some of the other hospitals, we're definitely going to continue to keep those lines of communications open, and we're going to continue. I think internally, kind of to piggyback off what Ms. Mary was talking about, how they communicate with the nursing staff and the other departments. At times, it's difficult for that to happen smoothly here because there's so many moving parts. But because of the pandemic, I've seen definitely an increase, a positive increase in the amount that we communicate because we have no other choice. But not only the increase in the communication, but the amount of support from each department has gone up to a point to where you really feel like everybody has your back. There's more of a larger amount of respect for each department, not just for what your employees or your teams are doing, but really that everybody has a common goal to provide a safe, clean, healthy environment for our patients, families, and each other to heal in, to work in, and just to make sure that we're taking care of what we can take care of while we can. So just going forward, just continue to improving on the relationships we have outside of the facility, and definitely continue to improve the relationships we have inside the facility is what we're gonna keep doing going forward. Just it just strengthens the team effort, and it just allows us to provide better care, a better environment for our patients, families, and each other.
Good. How about you, Mary? Besides keeping the doors locked.
Oh, we just want to keep those doors barricaded. No, seriously, the same. I guess the same would really go for us too, as far as keeping the lines of the communications open with members of our coalition for our area, and that also helps us overcome any future issues regarding shortages, because we'll have the ability to call upon more facilities to kind of help us through these things. I think that's really about it. Just education going forward.
Yeah. Well, you're all doing a great job. So carrying on with what you're doing will definitely work. Steve, what do you have for us?
Well, I think in line with Gregory and Mary, communication is paramount to all this, and we know that we have each other to reach out to, whether it's a phone call or email, or also on IEHA's website, there's a chat forum called Unify that we post questions to. The vast majority people respond to and as long as we continue to communicate, I think we will be very effective. One of the other things, from the NVE aspect is, or environmental health and safety in general, we have a lot of project managers, and they are well educated in what they do. They receive a lot of training, and a lot of these things, it just requires common sense, reason, and logic. And that in order to keep people from becoming infected, you got to keep them separated. And as long as we use our PPE and our masks, we're pretty much good to go. One of the major concerns that I have, from an OSHA perspective, is dealing with using the term mask versus face coverings, and there's a big difference between the two. And there's a lot of guidance out there. If you look at it from the OSHA perspective, I think everyone needs to understand that whenever you put something over your mouth and nose, complications can result from that, and they need to be well educated in that area. But communications, alternate work schedules, and they talk about the quote the new norm. I think that will be the standard going forward. Is we just have to adapt like we always have, through many years.
Very good, very good. So two quick questions to wrap this up today. And it's a way of letting the industry know about what they can get from IEHA. So how has being part of IEHA helped you during the pandemic? And Mary, I think it's time to start with you.
I really value the relationships that I've developed over the years with IEHA. There are a number of my peers that there's just vast amounts of knowledge out there that we can tap into. If we do have any questions or we're in need of support, or really just an ear to bounce something off of, another person to say, hey, am I doing the right thing here? And I really value those relationships.
Good. And Steve, how about you?
Well, I agree with Mary. As long as we have each other to refer to in times of need, we're good to go. I call and I listen to and I read on Unify, and sometimes when I think I've done everything that I should do or should be doing, I see someone else post something and I say, God, why didn't I think of that? Okay, and it's just simple things, but it's those simple things that keep people safe, and I appreciate that.
Cool. And Greg?
Rounded out, that knowledge base is invaluable. Definitely being that there's always more experienced leaders out there that you can bounce things off of, and just sharing information, sharing ideas, and having that sounding board, it's invaluable. So I appreciate it.
So this program you're talking about is called Unify?
Is the online chat forum on the IEHA website.
So it's for members.
Yeah.
It's a member benefit.
Yeah.
Yes.
Yeah, it's on our intranet. So it's part of our intranet and available to members to use, so that primarily it's used for individuals to ask technical questions. And that way some of our more seasoned leaders, will normally tap in and offer solutions or recommendations in real time to help support the members in our organization. And it's open to any member. They have access and they can post questions at any time.
Wow, what a fantastic tool. You guys are like a perfect little club with what you can share with each other and help each other out. I'm sure that's something with some good content, that function, that tool. All right, our last question is this. Now, some of you might have to go back in time to think about your answer here, but what inspired you originally to become certified members of IEHA? And I don't know, whose turn is it to start? Maybe Greg, start with you.
I can start it off. So definitely what inspired me to become certified was more credibility, because, I've been in the business for a number of years, but sometimes in others' eyes, without credentials or without that certification, they don't take your word to be what it is. They take you more serious when you are certified. They value your opinion more sometimes. And not only that, just the certification and the credentialing, but definitely for myself, I wanted to be able to expand my knowledge base and, continue to improve upon that. So that was my primary reason for wanting to be certified.
Good. And Mary, how about you?
Actually, really just about the same. When I first came into this business, I didn't have a clue as to what to do as a housekeeper. And someone once told me that, you don't necessarily have to go in knowing the job, you just need to know how to obtain the information. And that was really one of my driving forces for doing that, was to learn more about the industry and take that information and hopefully pass it along to my own staff and and it's been quite the benefit for them.
I think
And I
most would,
appreciate that.
yeah, I think most would agree that when we first get started, we don't know much, but we quickly learn
Very quickly.
very quickly. And Steve, how about you? What inspired you?
Um, I'm laughing a little bit because it was a requirement of the position that I originally had when I got into housekeeping, because I was the quality control manager at Brooke Army Medical Center in Texas. And one of the requirements of the contract was that you had to be certified as a CEH, REH, and so on. So I said, certified as what? And they said, certified in housekeeping. I said, housekeeping? And I had no interest in housekeeping whatsoever, only because I didn't understand it. And I said, what can you have to be certified as a housekeeper? What did that entail? So being that I already had my BS degree in healthcare management, I went ahead and challenged the test for at that time, it was called a registered executive housekeeper. And then as I was going through it, I was pretty amazed at all the questions that were thrown at me during the test, but they were all things that I have experienced in my healthcare profession. And that was in 2010. So since then, I've gotten my master's certification. You know, thanks to Michael still pushing on me here and there. But what I would like to say to that is, after working all the 20 plus years in the healthcare industry, then getting out and working in other healthcare related fields, emergency operations and so forth, I had no idea of the education and training that was required for a quote, a housekeeper, environmental services worker, a custodian, because they have to have the knowledge to understand patient care, infection control, preventive medicine, sanitation and hygiene standards, and plus meet all the, the Joint Commission and accreditation standards. And I'm still astounded to this day how much training they are required to have. And so I appreciate the field. I appreciate everybody that it has given me more of appreciation that whenever I go somewhere, I don't care if it's a Walmart, a restaurant, or wherever, that I always make time to speak to the environmental services worker, because they just work so hard all the time.
Yes. Anyone who's not in our industry, they don't understand what it's about. I spent years as a carpet cleaner, and there's classes for carpet cleaning. In fact, I do training for carpet cleaning, certification training. And anyone who's not in the industry, they're like, there's a certification for carpet cleaning. Oh, there is. And it's an intense 2 days. And there's more to what we do than they know. So I totally understand where you all are coming from. Hey, Mike, so you're going to keep pushing Steve forward, it sounds like. He said that. But
Absolutely.
Can you tell us, as we wrap this up, if whoever's watching this today, if they want to be part of IEHA, how can they do that?
Sure. They can simply reach out to IEHA via our website at IEHA.org. They may also contact us via phone at 800-225-4772 and just ask for IEHA, and they'll be directed, directly to us. Would love to interact with other individuals that are seeking to or aspiring to become leaders in the industry and want to know more about the technical side of it and what they could do in order to advance in their careers. We'd love to chat with them.
Well, sounds easy enough. Visit the website. That's probably what most will do. But thank you all for your time today. And let's get together again. Maybe next time we can talk about some of those topics in your very cool Unify intranet program. I'm sure there's some hot topics in there we could discuss.
Absolutely. We welcome that, Jeff.
All right. Talk to you guys later.